Hi, this is Jane Howington. I'm your host today on the North of 60 show. Today we'll be talking about heart issues with a well-known, I hope, cardiologist, Dr. Bage, and he is a cardiologist from Western Reserve Hospital. He specializes in invasive cardiology services, and he's here today. Thank you. It was great having you here. I appreciate it.
Well, thanks for having me.
Yeah, it's one of the things that I think that so many of our senior citizens have issues with or worry about, but maybe don't know much about, is their heart, our heart issues. And sometimes I know with me and with my mom, who just turned 88 yesterday, we don't always know that a symptom might be connected to a heart issue. So I wanted to start today talking about heart health. And, well, we all know, watch your diet and rest and exercise and all of that. Some of the things that impact heart health that we might not know of, for instance, depression or anxiety, how do things like that, or sleep apnea, how do they, we wouldn't even know that they're a part of the health.
No, you bring up some very important points. Heart health is affected by so many things, and it's really bidirectional. If people have experienced an adverse cardiac event, like a heart attack or needing open heart surgery, it's very common for those people to sink into a deep depression that may affect their lifestyle. Conversely, though, if people have untreated or uncontrolled depression or anxiety, that constant level of stress and depression may actually put them at greater risk for adverse cardiac events, not just heart attacks, but other cardiovascular issues as well. You mentioned sleep apnea. Sleep apnea is a very common condition that most of us really don't think about, because many people who have early sleep apnea don't have symptoms, or they're not aware of it. Maybe their partner understands better that there's snoring or episodes where you're not breathing appropriately at night, but untreated, that can go on to increase your risk of heart rhythm disorders, high blood pressure, obesity, difficulty with exercise intolerance, shortness of breath, and even high blood pressure within your lung blood vessels that can go on and weaken the right-sided pumping chamber of your heart and have long-term adverse outcomes.
So Dr. Bage, we've been talking about sleep apnea and some of the side effects of undiagnosed things that we don't even know are related to heart issues or could lead to heart issues. And I understand that with heart failure, there's sometimes some other side effects like maybe jaw pain or being nauseous or whatever. So how do we know when we have those things that we should get checked out?
Well, you bring up some good points. Certainly you have to have a high index of suspicion. We all have little aches and pains, and most of those aren't anything serious. But if you have something that's limiting your lifestyle, that's progressive, that just doesn't seem right, the best thing to do is see your doctor and have it evaluated. And we all think of classic heart attack symptoms, angina, heart pain from not getting adequate blood supply to the heart muscle, as being an elephant sitting on your chest. But it could be anything basically from the tip of your nose to the middle of your chest or your abdomen. People could have jaw pain, tooth pain. People have gone to the dentist certain that they had a bad tooth and they were having a heart attack.
Oh,
you might have pain, heaviness, tightness, squeezing one or both arms in your chest. And a lot of times when people have heartburn, it's their gastrointestinal tract, their stomach acting up. Sometimes heartburn is actually your heart. And people might be short of breath, sweaty, nauseated, dizzy, and all of those could be symptoms that your heart muscle is being affected by a narrowed or blocked heart artery that's not giving it adequate supply, and it's complaining in its own way. Women tend to present a little bit less classically than men because of some of the early studies that were done on men in the VA population, and so they didn't realize that ladies tend to have less chest discomfort or heaviness, more shortness of breath, fatigue, dizziness. And so we all have to just be aware that any of those symptoms could potentially be a problem.
You're talking about me right now.
Hopefully not.
No, but I think that's really helpful to kind of understand, like if I've been working out in the garden and I'm sweaty and short of breath, it's probably because I've been exerting myself, as opposed to I'm sitting watching TV or something and all of a sudden.
Absolutely. So those symptoms would be more worrisome if they originated at rest or with minimal exertion. But even if you're an avid gardener and you find that in springtime you can go out and work all day, and then a month or so later you're becoming progressively limited by the symptoms, then that might be a warning sign that something's going on with your heart. You also mentioned heart failure, and heart failure is really the inability of the heart to meet the metabolic demands of the body at the time. And so people might be short of breath or intolerant of exercise, but over time people tend often, not always, to retain fluid. And we think of people with big swollen legs or shortness of breath when they lie down flat, maybe a non-productive cough, or sometimes in extreme cases a pink frothy sort of cough that has to do with all this fluid that's backed up into your lungs and interfering with your breathing.
I see. I've always wondered why during a physical exam they'll check my ankles, and and I just always wondered, well, maybe I'm holding fluid or something, but it's really they're looking at potential heart issues.
They are. There are many things that could cause swollen ankles, but one of the more worrisome things on the list would be congestive heart failure.
Okay. And can you explain to me what the difference is between heart failure and a heart attack?
Sure. So heart failure may be independent of a problem with your heart arteries being narrowed. You might have a strong heart muscle that's stiff and just doesn't relax, even though it squeezes well, it doesn't relax and fill up well, or a heart muscle that's been damaged because of long-standing high blood pressure, prior heart attacks, trouble with blood flow that has not yet caused a heart attack, or leaky or sticky heart valves. People who have a heart attack are actually actively injuring and perhaps killing off part of their heart muscle because of a blocked heart artery.
Okay.
And the heart attack is a medical emergency. That's something where we were talking earlier that people are sometimes reluctant to seek help. They don't want to bother anybody. If you think that there could be a heart attack occurring, the best thing is to go to the hospital. It's much easier. Everyone's worried that they're going to be accused of crying wolf. It's better to go in and be checked out and have it turn out to be something that's not as threatening as to sit home and wait for confirmation that you've had a life-threatening event.
It
could
be too late, right? So cholesterol is a big issue, and cholesterol leads toward what kind of problems with the heart?
Sure. So certainly there's lots of controversy about cholesterol treatment and what the ideal level might be. Over years, we found out that certain elements within that so-called lipid panel, the different types of cholesterol that you might have tested in your bloodstream, are more likely to cause problems. The LDL, or bad cholesterol, and certain subsets of that tend over time to deposit in different areas in our body within blood vessels. And those areas where they're deposited, those deposits may continue to grow, to thicken, and actually encroach upon the lumen of the artery so that you have diminished blood flow. Under certain circumstances, a plaque, a deposit that's within the arteries, may become inflamed and rupture, and then your body will form a blood clot over top of that region, and then you've completely obstructed blood flow downstream, and the heart muscle downstream, or the brain tissue downstream from that clogged artery starts to die off, and then you have the symptoms associated with a heart attack, or in the case of the brain, a stroke.
My goodness. So and cholesterol is not the only thing that causes artery blockages and so on, but what's the early detection for blood clots? I have a friend, one of the seniors at our senior network was talking to me the other day, and she was saying how she's trying to lose weight because her doctor said that her cholesterol was becoming a little elevated and wanted her to start taking medicine for it. And she thought, no, I want to try and lose weight because that would be a more healthy thing. But we want to make sure if we really should be taking medication for it, you know, how's that detection and that early treatment balance?
Sure. So now some people may, through lifestyle changes, exercise, changes in diet, weight loss, may be able to get risk factors such as high cholesterol, diabetes, high blood pressure under control. Many people, though, even with all those efforts, which should be encouraged, may still not be able to hit goal and may still need medications, and sometimes putting off that therapy just puts yourself at greater risk.
And are those medications pretty effective to lower your cholesterol?
They're actually very effective.
Okay.
Some people may not tolerate them. The vast majority of people tolerate them very well with no side effects whatsoever. There are some people who may not tolerate one or several classes of medications, but fortunately there's several out there so that you might be able to find one that helps the individual. The first step is going to be looking at your risk factors. Don't smoke. Control your blood pressure. Know if you have diabetes and treat it if you do. Know if you have high cholesterol and treat it if you do. Try and follow a relatively healthy lifestyle. Now, one thing we can't run away from is our genetics. Some people are blessed and some people are just destined to be at greater risk for cardiovascular disease because of genetics. In those cases, in addition to checking all those risk factors and being on surveillance, not neurotic, but on surveillance for any symptoms, you may want to do some testing. One test that sometimes can be used in very select circumstances to know how aggressive should I be with my cholesterol, for example, would be a CT coronary calcium score. That isn't ideal for everyone, but in some people that could be helpful. Stress testing is another modality to non-invasively evaluate for the possibility of a significant narrowing. You or I might pass a stress test and have a mild narrowing that somewhere down the road will get worse, but at least it tells us at that point in time we're pretty safe. Then the gold standard would be to do a heart catheterization, an invasive procedure where contrast dye is injected through an artery and a camera over top of the body images those pictures, and they can tell us whether there's any narrowings, their severity and location, but we tend to reserve the more invasive procedures and tests for people who are perhaps having the misfortune of a heart attack or a warning sign, or someone who's already undergone non-invasive testing like a stress test that's abnormal.
How does arterial AFib, how does that fit into this discussion of the cholesterol and the blood clots and the narrowing of the arteries and so on?
So atrial fibrillation can be a problem in and of itself, even without any other structural heart disease, or sometimes associated with other problems, such as leaky or sticky heart valves, uncontrolled high blood pressure, untreated or undiagnosed sleep apnea are all risk factors for atrial fibrillation. But as anyone who's turned on the TV and seen all the commercials trying to treat, tell you how to treat or diagnose your AFib, it's incredibly common. It increases the risk of stroke dramatically, and that's because when people have atrial fibrillation, they may be at risk to form little blood clots in the upper chambers of the heart, the atria, the ones that aren't beating effectively or fibrillating or quivering. Those blood clots can break off and go anywhere, including to your brain, and cause a stroke. Some people who have atrial fibrillation have no symptoms. They're not even aware. It may be found by accident, or maybe when they come in having a stroke. In many cases, though, people who have atrial fibrillation may feel a fluttering sensation, palpitation. They may be more short of breath or intolerant of exercise. So the symptoms that people manifest can be very different from person to person. The first step is figuring out whether you have it or not, and then taking the appropriate therapy to protect yourself against any of the downside risks, such as a stroke.
Now, I know that people that have AFib often will just go in an outpatient thing and get shocked, if you will. That's one of the easy solutions to try and bring your heart back into the right rhythm and so on. After a certain period of time, if AFib is coming back repeatedly or more often, more frequently, they do some other testing like echocardiograms.
Yeah, so when you have the initial diagnosis of atrial fibrillation, certainly the EKG is going to be instrumental in that diagnosis. And right then and there, you'll probably want to get an ultrasound picture of your heart, an echocardiogram, to look to see if you have a weakened heart muscle, if you have any narrowed or leaking valves, or something else that might predispose you to the AFib, because in those cases, the AFib may be a sign of another condition rather than a condition in and of itself. When people have atrial fibrillation, there's a tendency for their heart to race quickly, and they may need medicines to slow their heart rate down, whether or not they're symptomatic from that. And often, not always, depending on circumstances, they may need blood thinners or another or a procedure to decrease the risk of blood clots and strokes. If people are very symptomatic or their AFib is difficult to control, they may undergo an outpatient procedure, the cardioversion that you talked about, where they're given sedation through the IV. They're still breathing on their own, but once they're in kind of a twilight, like someone getting a colonoscopy, they have a little low current electric shock administered to try and reset their heart rhythm back to normal. Now, it's not as exciting as the movies where they try and jumpstart somebody's heart and they bounce off the bed. It's sort of a little shock where we're just trying to reset your heart rhythm. But if that's unsuccessful, or if AFib keeps coming back and it's really annoying in terms of symptoms and limiting to the patient, they may be put on a number of different medicines to help stabilize the heart rhythm. They might have to undergo another cardioversion, another shock procedure. And in some cases, people may need what's called an ablation, an invasive procedure where a little catheter is passed under fluoroscopic guidance up to the upper left chamber of your heart where the atrial fibrillation comes from. And that catheter can heat up at the tip and actually burn or scar the area that originates the AFib electrically and sometimes be curative.
Wow, that's really, it's incredible what medicine
technology
does.
is pretty amazing.
Wow, that's amazing. So I think with the AFib, and I know we've talked a lot about it, but it sounds like the kind of the catchy thing is if you don't have any symptoms and you might not recognize it.
No, and that's a big issue. And as we get older, AFib becomes very common when people reach my age and older. With each decade of life over the 60s, it just increases exponentially. And so that's why being on surveillance for symptoms is important, but even something as simple as just learning to check your pulse. And if it feels regular, okay, you're fine. If it's irregular or chaotic, there may be a problem. Nowadays with technology, a lot of people have smart watches. There's these devices on TV that you can buy from Amazon, the Cardio Mobile, all these different sorts of things that you might use to also just be on surveillance to make sure that you don't have atrial fibrillation.
I think there's a balance between surveillance and becoming a hypochondriac with all of this technology.
There is. We talked about the problems earlier of depression and anxiety. People can make themselves sick by being too stressed about these possibilities. So I think there's that balance, trying to live your life and enjoy it, but also being aware that there might be something amiss and that you should just seek evaluation if something doesn't seem right.
Which is another big plug for making sure you get your annual checkups.
I would agree.
Because I know in my younger years, many of people, including myself, there's nothing wrong. I don't have to go to the doctor. But as you get older, it's important to have that relationship and have that experience. I want to go back to something that we kind of maybe glossed over a little bit, and that's angina.
Yes, so angina, or angina, I've heard it pronounced both ways, is simply some form of discomfort or unusual symptoms that someone experiences when their heart muscle is not getting adequate blood supply. Now, often what will happen is someone is starting to develop a narrowing, and maybe they're asymptomatic at rest, but when they walk up the stairs, or they're, they're hurrying, or they're under some sort of physical or emotional stress, they may get these symptoms. And so classically, that's squeezing, tightness, heaviness, some uneasy feeling in your chest, your jaw, your shoulders, down one or both arms. But as we said earlier, it could radiate to your jaw. You could misinterpret it as chest pain. You may think you injured your hand when it's really a symptom. But some people will have what they might call an anginal equivalent. So instead of chest discomfort, they may just feel short of breath, or fatigued, or sweaty, or nauseated. Some people will even have an urge to empty their bowels if they're having this. And so it sometimes can be confused for many other things.
Well, I think the message is coming through loud and clear that listen to your body, and if you start having some of these symptoms, especially repeatedly or increasing, don't resist going to the doctor or the hospital.
No, and that's absolutely correct. And you mentioned earlier, it's wise that people have a good relationship with their primary care physician and just touch base periodically, because sometimes screening may pick up something early that you really weren't even aware of yourself.
Which is also very important, because I know, again, with technology, it used to be, way back in my younger years, if I was moving from one place to another, I had to physically go to the doctor's office and get my files and take them to the new place, and now they can be electronically transferred, which helps a lot, because that my EKGs, annual EKGs or whatever, now the new doctor has some experience with me. So we're getting a little bit close to being at the end of our time together, and I want to ask you your advice for people 65 and older, maybe healthy people. I mean, if you're a healthy person, you may not know these things are happening. What kind of advice would you give to people as they age up?
Well, just being in the specialty I'm in, I see people of all ages, but really a lot of people who are aging successfully. And those who are aging successfully seem to follow one rule. They don't sit still. They keep moving. And so those people who have an active lifestyle seem to do much better, not just from a cardiovascular standpoint, but emotionally, and their entire physical well-being seems to be better. Obviously, life's too short. There's going to be special occasions. You're going to cheat occasionally. Mm-hmm. Just, eating relatively healthy most of the time, exercising, and just being aware that if you do have some medical conditions, it's better to treat them than to just stick your head in the sand and pretend they don't exist. Well,
it's been very interesting to have this conversation with you, and I think that it really brings out, besides a stroke or a heart attack or congestive heart failure, those are things that are more kind of advanced, that our awareness for a lot of these simple things that affect us that we might not otherwise be thinking of too much. Now when I go out in the garden, I'll have to decide whether I'm not going out as long as I used to. Or maybe it's just I don't really want to weed anymore. But but it's important to really listen to the body and get your annual checkups and so on. And I will put in a little bit of a plug. When you talk about people keep moving, many people know about silver sneakers, but not everybody knows about it. And a lot of gyms and things around offer that free as part of your health insurance and so on. Keep moving, go into those places once in a while, and keep yourself active.
No, that's great advice.
It's really a great program. And thank you so very much. I don't know if there's anything I can answer for you, but this has been wonderful. As I say, we've never had a cardiologist. We've never really had a talk about heart issues as we age up. And this will be very, very well received, I'm sure.
Well, thanks for having me. It's been a pleasure.
It's very much so. Thank you. And thanks to all of you for listening in. And if you have any other questions, feel free to get in touch with me. We can do some follow-ups and have other programs. And in the meantime, keep yourself happy, healthy, and active. And this is Jane signing off on North of 60.